what important to remember is that adverse events do occur with drugs or with vaccines or any other health intervention. Now, if an adverse event warrants hospitalization, then it is called as a serious adverse event. And as mentioned, it is the role of the regulator, after collating all the data, to ascertain or refute whether there is a causal link to the event and the intervention. So that causal link, whether it has to be ascertained or refuted, has to be done by the Drug Controller General of India once he has got all the papers which are time bound, and they have been submitted accordingly across all these 5 parameters which have been explained by the Health Secretary. The Institute Ethics Committee, the DSLB, the first is the consent, then the Ethics Committee, then the DSMB, and now the Drug Controller General of India to review them. This is done purely on a scientific basis, and the assessment is done with very objectively based criteria, and initial causality assessment findings did not necessitate stoppage of these trials.
नितेंद्र डीडी न्यूज से बोल रहा हूँ सर। जिस तरह की सरकार प्लान कर रही है लोगों को वैक्सीन देने की, क्या उन लोगों को भी इसमें शामिल किया जाएगा जिनको कोरोना हो चुका है या एंटीबॉडी डेवलप कर चुका है?
ये मैं प्रारंभिक जानकारी दे दूं, उसके बाद डॉक्टर भार्गव सप्लीमेंट करेंगे। जो नेशनल एक्सपर्ट ग्रुप है वैक्सीन एडमिनिस्ट्रेशन के बारे में, जिसकी अध्यक्षता डॉक्टर वीके पॉल मेंबर नीति आयोग करते हैं, उसके मैंडेट में एक मैंडेट ये भी है, और इसके बारे में विश्व के अनेक देश सोच रहे हैं कि क्या आपको ये देखना चाहिए वैक्सीनेशन के समय कि जिस व्यक्ति को आप वैक्सीनेट कर रहे हैं उसमें एंटीबॉडीज़ हैं कि नहीं हैं। इस पर कोई अंतिम निर्णय अभी नहीं हुआ है, लेकिन ये वैज्ञानिक कम्युनिटी में भी और देशों के बीच भी चर्चा का विषय है।
Yes, this is a good question, and as there are 2 issues linked in this. One is that if someone has antibodies and if you give the vaccine, can he develop any vaccine associated adverse reaction? That is the first issue. The second issue is that if we measure the antibodies, then can we avoid giving the vaccine to that patient, and therefore can we spare our vaccines? So these are the 2 important issues. Regarding the first one, vaccine associated adverse reactions, there is enough data to show that that does not happen. However, there are discussions still going on internationally. The WHO has clearly stated in all its solidarity vaccine trials also that we do not need to measure the antibodies or even find out if that person has had the COVID or not. We can go ahead and give it. That is what is in the mandate of the WHO at the moment.